Welcome to Champions of Care from Oakwood Healthcare. My name is Mary Zatina, and today we're going to talk about how to prevent a heart attack. The American Heart Association estimates that 37% of Americans have heart disease. Now, you don't want to be one of them. Today, here in the studio to help talk about how we prevent a heart attack and take good care of our heart health is Dr. Waleed Harb. Dr. Harb is an Oakwood-affiliated physician, internal medicine physician, affiliated with Oakwood Healthcare, and he has offices in Dearborn. Dr. Harb, welcome to Champions of Care.
Thank you for having me.
Dr. Harb, let's just cut to the chase.
Yes.
Is there one magic thing we all can do to have good heart health?
Well, although there's so many different things that we can do to improve our heart health, one single thing that can give us the biggest bang for our bucks is to stop smoking. So if somebody is smoking, that is the single most biggest risk factor that we have in cardiac disease.
And what about body weight? I hear this BMI. I don't really know what BMI stands for. What is it, and what's a good BMI, and what's a not so good BMI?
Yeah. BMI is one way to equate the different weights with how our body are built, small frame, bigger frame. And so they take the weight in kilogram by the surface area of the body, depending if somebody thin or short or large. So BMI, a good BMI is between 19 and 25.
And BMI stands for Body Mass Index.
Yes.
BMI.
BMI.
So a good one is?
Between 19 and up to 25. Between 25 and 30 is overweight. Over 30 is definition of obesity. Over 40 is the definition of morbid obesity, which is extreme type of obesity.
So you've said the single most important thing we can do is not smoke or stop smoking.
Absolutely.
And have a good BMI or the right body weight for our frame size. Now, what about nutrition? And are there some magic heart health foods we should eat? And how do we get those into our daily diet?
Absolutely. Diet is extremely important. We need to have more fruit and vegetables, the right type of oils in our diet. In general, research have shown that people overestimate the amount of exercise they do and always underestimate how much calories they do. So having a diary and eating, planning your meals every day is extremely important. But more fruit and vegetables and the good oils.
Okay, now you hinted at exercise.
Yes.
How much exercise do we really need? And is there some exercise that's better than others?
There's been a lot of research on different kind of exercises. My recommendation is to exercise, whether it's fast walking. Find out what things somebody loves to do, whether it's swimming, biking, and tailor-make that exercise regimen to their time. Same thing as planning for meals or sleep. We should also plan for exercise. So the days that we're able to, we should pencil it in from 6 o'clock to 6:30, from 6 o'clock to 7 o'clock. We need to be on a treadmill or swimming, and so it should be a daily thing. If we can't do it daily, maybe three times a week would be sufficient.
So these are some things all of us can do.
Absolutely.
But if I suspect something's wrong, something tells me that the best thing to do is to talk to my physician. And one of your colleagues, Dr. Peter Mancini, has some thoughts for us about patient to physician communication. Let's take a look.
Do you have a heart condition? If you answered no, you're going to want to watch this segment. I'm here at the offices of the Dearborn Cardiology Associates to speak with Dr. Peter Mancini. He truly believes that the reason heart disease is still the #1 cause of death in the United States is because patients have heart disease and don't even know it. Dr. Mancini, welcome to Champions of Care. over the last 30 to 40 years, we've spent billions of dollars on cardiac research, but yet heart attacks are still the #1 killer. Why do you think that is?
That shouldn't be. I believe the biggest problem that we have is there is a huge gap in communication between doctors and patients. There is assumptions that patients will make. They don't divulge all information.
So, Dr. Mancini, how would you describe that gap in communication?
Well, each person, the doctor has an agenda, and so does the patient. Unfortunately, the patient's agenda is a lot of times to just get out of there. The World War II generation, they minimize a lot of their symptoms. They don't tell the doctors everything. We were brought up by the World War II generation. We're taught to do that. That's a big no-no. So there's one reason why there's a large gap in communication. There's not an openness on the patient's side to let us know what's going on. Other gaps in communication is, I already alluded to it earlier, the word chest pain. When a doctor asks if you have chest pain, we don't mean, do you have pain in your chest? But chest pain to us is any discomfort or sensation that's abnormal, literally between your earlobe and your belly button, is chest pain to us. A patient will refer to chest pain as, well, it must be painful in order for them to complain of chest pain.
Well, it's interesting because you've touched upon a lot of topics that I really want to delve into as well. One of which is, when you describe chest pain to a patient, what is that feeling like for them?
Excellent question. You already have an idea of what to look out for from movies and videos and maybe family members that had chest discomforts. And unfortunately, the American public believes that anything that happens to the heart, it should be a profound discomfort. It's a severe pain. And many times I'll hear the patient tell me they don't have chest pain. And then when I dive deeper into the question, they say, well, yeah, I get that, and it's not that bad, so they don't talk about it. And that's the biggest problem. Pain severity seems to be the biggest issue that patients are concerned about, where a doctor is more concerned about what does that pain represent.
Some of the symptoms that are related to heart attack or heart conditions are also maybe not as obvious, like shortness of breath. Can you describe what that entails?
Excellent. Shortness of breath is a very common symptom of of angina, which is the lack of oxygen to the heart.
Now, some people know that, boy, if my left arm is hurting, that might be a sign of heart problem. Can you describe a little bit about that and share that with our audience?
When you get pain down the left arm, people instinctively know, oh, this might be my heart. That's one of those signals, I might need to go see a doctor. If they had not a very profound discomfort that went down the arm, yes, they're more likely to go, even though the severity's not there, that other warning sign is. Now here's the kicker. Not all left arm pain is the heart. I often hear hiatal hernia, reflux symptoms can go down the left arm. So, but that's our job. We'll figure that out when you get there. But if you do have these, what I call red flags, jaw discomfort, left arm discomfort, these are those red flags that we would evaluate further.
Another kind of tough one to decipher is indigestion.
Yes.
Oh, how do you help a patient with
Boy, you hit the nail on the head. Indigestion is the sensation of fullness, and it's usually in the abdomen, and it sometimes can translate up into the chest. Indigestion is a very difficult thing to figure out. Is it pressure in the chest? Is it in the stomach? Where does it start? I like to start with what are the eliciting factors bringing that discomfort out. If it's food related, you kind of lean on the GI side. If it's exertional related or emotional stress related, you lean on the heart side of things. It's not just indigestion and fullness and bloating, but burning in the chest. I am here to inform you that burning in the chest is the second most commonly described symptom of angina.
How should patients talk to their doctor to alert the doctor about symptoms?
The answer is just let us know what you're feeling. When we ask you if you're having chest pain, understand it's not just pain. Are you having any discomforts in your chest? Even if it's indigestion or burning and you think it's your stomach, we'll ask the follow-up questions to say, don't worry about it, that is your stomach. I want to get the word out there that patients need to do their job. They need to get to us. They need to let us know what they're feeling. Without that, we can't do our job.
Dr. Mancini, thank you so much for sharing all those life-saving tips with us today.
It's my pleasure.
Now, Dr. Harb, you're a primary care physician. What do you ask your patients to get them to tell you about what they might be feeling?
I tell them to tell me everything, any symptoms, and let me worry about what it means. Because sometimes certain things, they may not think it's bad, but it turned out to be really costly. And so let us worry about it. Let me worry about it. And I'll be there, we'll listen, and listen good, and then ask follow-up questions to come up with the right diagnosis.
Great. Well, we'll be talking more about heart health in just a few moments with the fine physicians from Oakwood Healthcare. And when we come back, you'll be learning about more things you can do to make sure you don't have a heart attack.